All right. Well, good morning, everyone. It is Monday, December 27th, 9:02 a.m. Thank you guys very much for being on the call after this very long and hopefully enjoyable weekend. Merry Christmas to everyone and Happy New Year coming up here. So, really appreciate you guys taking the time to be on the call today. And then we're going to go through just a few things this morning because it is a short week again this week. And I do want to make sure that everyone maximizes their time as they go through and get ready for the new year. So really do appreciate everyone taking the time to be on the call today. So first things first is why we're here, and as we end the year, it's always a good reflection to know that you're doing good out there in the community, because our mission is to improve the lives of our community with affordable healthcare. So again, thank you for being a part of that mission, and really thank yourselves for putting in the time, effort, energy, and all the hard work that you did in 2021, and now moving into 2022. So this is our last call of the year, but we're going to have our first call of the year. And what does that look like? What does that look like for you? What does 2022 look like for you and your success in your life and your business? And really take this week to really reflect on that. And I think this is a good time to do so. As far as training goes, obviously there's not much going on this week for training, but I do want to make mention that if you do have some downtime between family, please, please, please take the time, take the effort to learn HPM Shop. This is our brand new quote and enroll system, our tool that we've invested a lot of time, money, and energy in to bring this tool to you to really maximize your sales potential and also give everybody a chance to serve their members efficiently. We are in the digital age. We've been in the digital age for a long time, and it pains me to see people that are still doing paper applications. We're seeing most of those errors, issues, problems coming from paper applications. So, please take the time to learn HPM Shop. I know we have several people on the team that can guide you. On the training calendar, you'll be able to see every morning at 8 a.m. Tom has loaded up the link to our YouTube channel. Go out to our YouTube channel, refresh yourself, master that software system, because it will change your life when it comes to dealing with, Medicare and learning the business from that perspective. But shifting focus really quick, look at what's happening in ACA, the individual and family plans. Over the last week, I could tell you that Healthcare.gov, CMS released the numbers for enrollments in ACA. So we've hit an all-time high. There are now over 13.6 million enrollees in the Affordable Care Act through the marketplace. This is record-setting. This is history. It's never been this high. And why am I telling you this is because if you're not working ACA business, if you're not working individual and family plans, you really, really should consider getting into the business. And we can help you with that. We've got the ACA plans available across many states, no matter where you are. And it's another line of business that you don't have to go out into the field and do. You can do it from the comfort of your home. You can do it from the office, wherever you're working from. You can do it remotely. So 13.6 million people now using healthcare.gov to choose their health insurance. And that's with or without a broker. But as you want to be the agent of record there. So, if you need to get set up on that, please let us know, and we'll be glad to connect you and get those contracts going. Open enrollment for ACA business is still available and still going on until January 15th this year. So you still have, about a half a month to help those folks in need for individual and family plans. However, there's tons of SEPs available for those folks too. If, they got recently married or moved or, had a child, all of these are different reasons for an SEP where you can get people enrolled year round. And it's a good way to do it. Now, we know agents that are writing business year round for ACA and writing business year round for Medicare. It's another line of business. So as you consider going out into the new year, changing your game plan and strategizing, which we're going to talk about in a minute, take a look at ACA products because it's hotter than it ever has been. Okay, shifting focus to just notifications real quick. I've gotten a lot of calls, text, emails about the Humana notification of appointment email that was sent out last week by Humana. And what's happening there is we're getting emails from Humana, and what we're reading right away is termination, right? And it scares us all. But let me explain what this email is, because many of you may have seen it, may not. It's sitting in your inbox if you've checked your email. Many years ago, Humana got into several lines of business and created different products. Humana Dental, Comp Benefits, Humana Medicare Advantage, Humana Medical, and all of these different lines of business require to be appointed. So the state of Florida requires Humana to appoint every agent for each and every line of business. Well, now that they've had all these different lines of businesses, and many of these lines of businesses or quote unquote companies that Humana has set up are kind of defunct. They're not really functioning. No one's writing business on them. And so why are they paying millions and millions of dollars in appointment fees to the state of Florida? So what they decided to do is streamline a lot of those lines of business and get rid of those lines of business. And now that's where this notification is coming in and saying, hey, this line of business from Humana is no longer going to exist, but you're appointed with this old product. We're letting you know that it is being terminated, and you're being terminated from that particular appointment for that particular line of business, because it will no longer exist. Once they get rid of all the agents on that product, they can go ahead and go back to the state and delete the product from the appointment process. So I know it's confusing, but we will definitely call you, text you, or email if you ever have an issue with any of your appointments that are within reason. Jessica and Sam are now watching this and making sure that, if there's any issues with a terminated agent, that you will definitely know way ahead of time, as soon as we know. But that particular Humana was a generic email sent out to everyone that is contracted with Humana, letting them know that certain lines of business will be going away. And so those particular appointments will be terminated. Okay. Not your Medicare appointment or anything else like that. So you're good there. Okay. So again, just pay attention to these emails, because sometimes we see these hot words and we get scared and we just assume and we, pick up the phone and call or panic. We don't want to do that. We want to read the entire email and understand the email, because it is explained in that email. So nothing to worry about there. If you did, go through your emails and take a look at that, you'll see very clearly that it's just the appointments for certain lines of business. Okay. I'm going to keep the call relatively short. I wanted to bring up a situation that we kind of talked about a little bit last week. And this is for folks that are coming from Medicaid into Medicare for the first time. And so I got this question actually about 2 or 3 times last week. So this situation is going to happen more often than not, especially if you're out there talking to folks that are low income, individuals that have Medicaid now and are now just turning 65, or their disability got approved, so their 2 years are up, and then they get this Medicare card. Okay. Now, when you have just straight Medicaid, which is where your member is today, and they're getting ready to go into the Medicare system, let's say in January, February, March, whenever it is, and they called you and said, hey, I heard that you do Medicare. How can you help me? And so let's just say real quick that your member has Medicaid, okay? Medicaid only. When you have Medicaid only, and I'm going to use the state of Florida as an example, but this is pretty much across the country. When you have Medicaid only and no Medicare yet, the state of Florida is paying for your doctors, your hospitals, and your prescription drugs. Let me repeat that. The state of Florida, in this example for Medicaid, is paying for your doctors, your hospitals, and your prescription drug coverage. It's all baked into that one. We still have gold cards. Some people get them, some people don't. There's no rhyme or reason. But that gold card is then associated with a Medicaid HMO product. And so when somebody gets qualified for full Medicaid benefits, then what happens is they're automatically assigned into a Medicaid HMO product. And depending on where you live in the state of Florida, there's regions, and those regions have a select number of carriers that are willing to do business in that region. So here in Central Florida, let's just use Humana as an example. Humana has a Medicaid product, a Medicaid HMO. And so a member qualifies for Medicaid. They have the Humana Medicaid HMO product. And then so they are getting their health care from the doctors, hospitals, and prescription drug coverage through that particular Humana Medicaid product. Now Humana has a Medicare product, right? So that's different. But this particular Medicaid product with Humana is designed for that person that has full Medicaid. Okay. Now everything's going great. They go to their doctors, hospitals, prescriptions. Their Medicaid and Humana Medicaid HMO plan is paying for everything, so you're good there. But then this Medicare card comes in, okay? And let's say it starts in January. So if they don't do anything, if they've never met you, if they don't touch anything, if they don't do anything, and they turn 65, or they get their disability, and they get their Medicare card in the mail, if they don't do anything, here's what's going to happen, okay? With Medicaid, as soon as you turn on Medicare, Medicaid now becomes secondary. Okay, it gets bumped down. Medicare becomes primary, and then the Medicaid becomes secondary. So now that Medicaid and Humana is secondary to Medicare. Now, because the member is now going into the Medicare system for the first time, they will no longer get their prescription coverage through Medicaid. Because here's what's happening. The state says, oh, wait, you have government benefits now? Well, we're just going to go ahead and push that up to Social Security. So you're going to get your drugs from Social Security now in Medicare because you now qualify for a Medicare Part D program, right? So we're going to take you off of our books and we're going to remove our prescription drug benefit from Medicaid, okay? So now they have Medicare, they have Medicaid, and they have that Medicaid HMO, which now is no longer covering prescription drug coverage. So what happens? Where's the prescription drug coverage goes? It goes up to Medicare. The member qualifies for a Part D program. Because of low income, they now qualify for low income subsidy, and they're automatically assigned a prescription drug coverage plan, a Part D plan. So a round robin, right? So both Medicaid and the Part D programs become a round robin effect. So whether they choose a plan or they don't, if they don't do anything, they're just going to get a plan picked for them within 60 days, or I think 30 days of that enrollment process. And so now your member doesn't do anything. They have Medicaid. They have that Humana Medicaid product. They now have Medicare. And then they were assigned a prescription drug plan. And let's just say it's a Silver Script plan, right? So now they're walking around with all these cards, okay? They have Medicare. They have the Gold Card Medicaid. They have the Silver Script prescription drug plan. And they have the Humana Medicaid HMO product. So for anybody, that could be really confusing to have 4 different cards in your wallet and you don't really know what to do and what goes where, okay? So your job as an agent is to, number one, explain why that happened, like I just did for your members, explain what happens and why it's happening, and then help them streamline those benefits, okay? So by joining a Medicare Advantage plan, specifically a dual eligible special needs plan, you're going to kind of help streamline that back into how they used to use it before. So they still have Medicare and Medicaid, but they're going to take those government cards and they're going to put it in their wallet and they're going to save it off to the side. But now you're going to get them enrolled. And let's just use Humana as an example because they already have a Humana plan. Their doctors are most likely in the same network, but don't assume that. You're always going to want to double check the networks because the prescription, or I'm sorry, the Medicaid HMO product is not the same as the Medicare Advantage network. So those networks could be very different. So never assume that, always double check, but it's very likely that they have a lot of the same doctors. So you check the docs, all the docs are in. They have LIS, the prescription drug coverage, is covered by SilverScript right now. But by getting them enrolled into a D-SNP plan, and let's just use Humana as an example, their Medicare and Medicaid cards are sidelined. They're still active, but they're in their wallet. You now get them enrolled in a Medicare Advantage plan D-SNP. The SilverScript product will go away, right? Because you cannot have 2 Part D programs at the same time. The D-SNP has it baked in. The prescription drug coverage is bumped out. So now they just have that Humana Medicare D-SNP product, and they use that at the doctor, hospital, and pharmacy, just like they used to use before when they had their Medicaid only product. Okay, it's a little bit more complex, but I do want to make a couple of disclaimers there. Number one, you may meet your member before their Medicare is active. And if their Medicare is not yet active, their LIS will not show active yet. Okay, their Part D may not show active yet because it's just not active. And so you've got to wait until the first to get accurate information on what level they have for LIS. But their Medicaid benefits shouldn't change unless their income changes. Okay. Now here's another curveball here. Once you get into the partial Medicaid benefits, then a member may be walking around there and they don't have Medicaid because they don't qualify. But as soon as they join Medicare, they're going to qualify for partial Medicaid. So you kind of have to keep an eye on their income and have an estimate that they may qualify for Medicaid. As I mentioned before, there's a great website called benefitscheckup.org. You can go out to benefitscheckup.org and you can help your member apply for these programs. I do highly recommend that you become a master at that because it's a great lead source. When people start learning what you do for people, you're going to get referrals like crazy. So take time and learn that process. But I wanted to walk you through that because it does become confusing. And then we're getting more and more people that are currently on Medicaid and now they're going into the Medicare system for the first time. So if anyone needs additional training on that, please let me know. I'll be glad to put together a video or a training session where we can, deep dive and talk more about that transition, because I do think it's important, and I do think it's a really good thing to know, because people are going to be coming to you, and when they're turning 65, you don't want to make the wrong move. Okay. With that, I have a end of year checklist that I wanted to go through with you guys in the last 10 minutes of the call here. And this is just some basic house cleaning stuff that I want to make sure everybody is on top of. So the first thing is, please go out this week and use this week and this time to check your applications. Make sure that all of your members have been enrolled, that they've gotten their cards, that they're showing up in your portal system, that they're on HPM Shop, that they're in your CRM system. Whatever you're using to compile that information, make sure that you have everyone accounted for. Okay, this is really important because you will not have another chance to do this before the first of the year. Okay, once January 1st comes, if you forgot to hit the submit button on the application or the member's not showing up in your portal, it may be too late for a January 1st effective date. Okay, so please keep that in mind. Check your members' applications and ensure that all apps are accounted for. If you're missing one, this is a great time. This is a great week. If you have to go out and rewrite it or whatever, find that app or find the scope of appointment, whatever you're missing, this is the time to do it. Just make sure that you've got everything organized before you close out the year. Number two, call your members. Once you've checked your applications, if there are any issues, call those members and work that out. But also call your members. And this is a great time of year to check in with them, make sure that they've got their ID card, and make sure that you set up their doctor appointment. I will tell you that many of the many of the doctors now are going out there and actually compensating you. Some of these provider groups are compensating you for helping set up that first appointment. So as you're going through, while you're calling your members, if they haven't yet set up an appointment with their doctor, this could be a great time to get that done. The other part of this is Cigna specifically has extended their HRA submission form. So you have to go take your training at Cigna and do your HRA training. But you have until the end of the week to complete any additional HRA forms, health risk assessment forms that we've been talking about this entire season, to earn that additional income. Okay, so you have an extension to do that. This is another great opportunity for you to earn some extra cash, connect with your members, and ensure that they've got everything they need moving into the new year. Number 3, you're going to close any last minute leads, and this could be for ACA. Right now for ACA, we're writing for February 1st effective, or any Medicare SEPs. We've got lots and lots of SEPs out there specifically for Medicare. My favorite is the 5-star because that's super easy. You just check 5-star. I'm putting them on Care Plus because they're 5-star. Done deal, right? But also, while you're calling your members and checking in on them, you may get some referrals out of that. And, it's not too late and it's not too early of a OEP to get these people enrolled, especially if they're looking for a 5-star plan, or if they're looking, they've got a chronic condition, whatever the case might be as far as their SEP is concerned. That's your job. Find that SEP and get your member enrolled so they have great coverage moving into the first of the year. So go back through your Rolodex, go back through your notes, check in on each and every one of those leads. And I know how leads go sometimes. Sometimes, in the middle of AEP, you're getting 4, 5, 6 leads a day maybe, or you're getting phone calls like crazy. And maybe you got so busy that you forgot about a lead or two and you didn't follow up, okay? Over 80% of the business is captured after the 5th or 6th contact. So think about that. If you haven't called your member or those leads 5 or 6 times, then you're leaving 80% of the potential earnings on the table, okay? If you called a lead one time and they didn't answer, you left them a message, and then you got another lead, what happens is you forget about it and you go and you move on. But this is a great opportunity to go back and, I'm hoping everybody has some type of system for tracking leads. We have a system internally for our CRM, and we're glad to share what we do. So if you need to connect with us on that, we'll happily get that set up for you. But even just a simple spreadsheet, Google Forms, Google Sheets, very, very simple on tracking your leads. Just create a spreadsheet and then master that, really. And there's really only 2 lists that you need to have anyway, prospects and members. And when your members disenroll, you put them back in your prospect list. And if your prospect enrolls, you put them in your enrollment list. So very, very simple management when it comes to that. You don't have to make it any more complicated than that. So close those last minute leads. Make sure you follow up on that, because I think that's money on the table for you. And, it'll really help, close out those credit cards that we spend all of our Christmas money on for our families, right? So, follow up on those. The 4th thing that you can do to close out the year here is send out some thank you cards. Obviously this time of year is the time to reflect and show gratitude, and nothing better than, showing gratitude to your members. And I'm going to share an email here with you guys that I got this morning that I thought was kind of powerful here. And this is from, a guy that I do business with through the mail. But, his Christmas message this year was, "Hi, Justin, Merry Christmas from my family to yours. Thank you for giving me every paycheck I've received, every present under the tree this morning, and allowing me to live my life the way I want to live my life." Pretty powerful message, right? That's how important your clients are. They're the ones that pay your paycheck, not the health plans. They are. Because unless they decide to do business with you, you're not getting a commission check, right? So this is a great opportunity to show some gratitude, and it goes a long way, and it'll also kickstart the year for referrals as well. And then lastly, this morning, I want to share the last strategy here, or the last part that you should be working on year-end close is your strategy. And what is your strategy for open enrollment, for Medicare Advantage, for lock-in, for 2022? What are your goals? What are you looking to accomplish in your business life, for your members this year? And what are you trying to accomplish for yourself? And it doesn't have to be business related, right? I'll share a couple of goals that I'm looking for personally. I would love to start diving again. I'm a certified diver. I haven't been diving in a long time, and I want to go on a diving trip next year. And that's one of my personal goals, right? And I think that's, you got to think in those ways too. Of course, we have company goals and business goals that we want to reflect on and strategize for that. But what are your personal goals? What is your strategy for OEP? What are you going to be doing to working on growing your business, your book of business? This is really important, okay? It doesn't have to go crazy. You don't need 3 days of strategizing. Even if you sit down and you strategize for a solid 2 hours, it will save you months of work. It will really save you months of work, and it really make a difference in your productivity and doing what you're doing, okay? I will tell you that one of the strategies being for this year is, Sergio has been pitching to everybody that on January 1st, everyone's going to see a big dip in their Social Security check because their Medicare Part B premium is going up starting on the 1st. So you're going to see a $25 decrease in Social Security checks. Yeah, they gave back 6%, but then they took back 19% or whatever it is, going up to over $170 a month. That's a big hike, big jump. So connecting with your members, talking to your members, and strategizing, what are you going to be doing when somebody calls you and says, hey, what the heck happened? I used to get this much in my Social Security check, and now I get this much. I think there's going to be a scramble for business in January where people are going to be exploring, like, why is this happening? What's going on with everybody? This is really, really important. So strategize. Take the time to strategize. It's really, really important that you sit down and figure out what you're going to be doing from January to March. If you need help with this, if you need guidance, if you need coaching, we have folks at HPM that will be glad to help you strategize. Okay, so please, please, please take the time to set aside to get some strategy done. Okay, so that's it for the call. I do have a question here from Elisa. She wrote in the chat here, so thank you, Elisa, for your chat. Appreciate that. Elisa says, I have a kid who is on Medicaid, but I believe he has received a Medicare card, so the same rules apply, right? These folks think by me as an agent putting them on a dual plan is because their script costs are going to increase. We need to have proof to show them. Hopefully there is something printed on benefits.org. Okay, so I think you're referring to the prescription drug coverage. Yes, so what Elisa is referring to is when a person is on straight Medicaid, or in that example that I used earlier today, a Medicaid HMO with Humana, for instance, all of the drugs are $0. Okay, so all of the drugs are pretty much $0 when you go to Medicaid. And sometimes when you get them on Medicare and you go into the Part D program, LIS, these prescription drug costs go up to $1 or something, up to I think $9 now, depending on the prescription and depending on what level of LIS that they have and what tier level it falls in the prescription drug formulary. So one thing you have to keep in mind is that you have to explain this, that because the state is no longer going to be covering your drugs, you're going to be moving to Medicare Part D, and you can find those Medicare Part D prescription drug copays on Medicare.gov. They should be listed there. I don't have it in front of me, but on Benefits Checkup, it should be on there on LIS. But if you type in LIS, low income subsidy level, or copays into Google for 2022, it should pop up. Shouldn't be a big deal there. But if you can't find it, just let me know, and I'll be glad to distribute that for you. But I believe most of the LIS levels are now printed in the 2022 books. So if you pull out a DSNP enrollment kit and you flip over to the prescription drug section, it should be listed there under the LIS numbers too. But that's a great point, Elisa. Thank you for pointing that out. That maybe a member is taking 5 or 6 drugs on Medicaid, and now they're shifting into Part D for the first time. If any of those drugs are brand name drugs or non-preferred drugs, then that is correct. The prescription drug copays are going to go up, not significantly, but a couple bucks here, a couple bucks there. Their assumption is that you did something that messed them up. It's just what it is, right? We can't control that. So great question, great feedback. Really appreciate that. Okay, we are over time. I thought it was going to be a shorter call, but I went over. Sorry, guys. But first and foremost, thank you very much for being a part of the HPM family. I truly, truly appreciate your partnership. Thank you for being good to my team. Thank you for working with us. We understand you have a choice to work with tons of different agencies, and we really appreciate the opportunity to serve you. As we move into the new year, I do want to express my gratitude. I hope everyone has a fantastic, safe, and wonderful new year. Please be safe out there and be good. Spend time with your families and focus on what's important to you and what's important to your members. All right, guys, have a wonderful day and have a fantastic week.